Good afternoon to all. Today I'll be presenting spectrum of laser light injuries and their clinical outcomes. I have no financial disclosures. Laser lights are highly directional monochromatic sources of light that are focused in a small area. They are used in disco lights and decorative purposes. September is a month of religious activities and increased laser light usage. Hence, more laser light injuries are seen in these months. We in our study documented 13 mutually exclusive cases in a month, and hence, as the frequency was more than that we had observed before, we proceeded with the study. In this study, 13 eyes of 13 patients who in the month of September 2023 had recreational laser light exposure were included in the study. 11 patients in the study were males, 2 were females. The mean age was 25.23 years, and all patients had unilateral injury. Of all the patients, 9 patients had sub-ILM hemorrhages and 1 patient had intra and subretinal hemorrhage. 1 had macular hole, 1 had a cyst at the macula, and 1 had outer layer disruption. Of all the patients who had sub-ILM hemorrhages, 3 patients underwent surgical management within 2 weeks of presentation, 2 patients underwent delayed surgery, and 4 did not opt for surgery. This is the representative video for all the patients who underwent surgery, in which the patients underwent ILMP, and using the reflux function of the cutter, blood was removed. In all the patients who had sub-ILM hemorrhage, whether they underwent surgery or not, the hemorrhage resolved. But the ones who underwent surgical management achieved a vision of 6.6, and the ones who did not achieved a vision of 6.9. One patient had intraretinal and subretinal hemorrhage who immediately underwent intravitreal SF6 injection, and at 5 weeks had complete resolution of hemorrhage. At 3 months, the patient had a small EZ and IZ loss and achieved a visual potential of 612. The patient with a macular hole did not undergo any surgery, and at 3 months had flat open macular hole configuration with a visual acuity of 624. Patient number 12 had a cystic lesion, and patient number 13 had a RP, EZ and IZ loss, which at 3 months all the OCT features resolved. But in the case of patient 12, the BCVA achieved was 6.9, and in the case of patient 13 was 6/12. This is the data regarding all the patients in our study. Laser light causes damage by the mechanism of photo disruption, photochemical and photothermal injury. RPE cells are at the forefront of the greatest damage, and photoreceptors are damaged as bystanders. In our study, 80% of the patients had macular hemorrhages, wherein as the macula is very vascular, the choroidal and retinal vessels rupture and the hemorrhages are caused. And also, when the peripheral retina is stimulated by the laser light, there is an instinctive turning of the head towards the laser light, causing the laser light injury. Also, during dark, the pupils are dilated. Hence, more laser light is incident on the retina, and thus it's more damaging during dark. Also, in pigmented fundi, the energy absorbed by the choroid is more. The increase in the laser light injury that has been seen recently is because the manufacturing process is not regulated, and the power output is much more than that has been labeled, and also a diffraction filter that is normally there is removed. Hence, the laser lights are more focused. Also, there is unregulated sale of class 3 lasers on e-commerce websites. These are a few screenshots showing that the laser light injuries are on the rise. In the end, I would like to say that laser light injuries are on the rise, and young adults and children are at the brunt of injuries. We need to act now more than ever, and there need to be stringent laws. Articles like these might have been published before, but its importance is understood by few, and hence its need. Also, by my article, it also needs to be known that it is not an exclusive laser light paper which like the ones that have been published before. Here you need to see at the frequency within a month, every other day, we're seeing laser light injured patients. Hence the need of this paper. Thank you.
So why you specifically mentioned this month? Any particular reason for that?
I related this month with, we've seen a pattern. Whenever there is a festival season, we started this paper in the month of September. So September in Karnataka is the is the time when they do the Ganesh Visarjan, that time where there is a lot of dancing activities, lot of decoration, lot of laser lights being used. So we observed. Normally, what had happened is in the past previous years we used to see 1 or 2 patients in a month, but this time what we saw is every other day 13 patients. If you see European studies, uh, you see 7 patients in a paper that have been reported over a period of 1 year. Here we got 13 patients in a month. There are other Indian papers also that have reported 30 patients, but that 30 patient is for a single event. What we're saying is that laser light, these projectors are in every other event are so damaging to the eye that this is turning out to be an epidemic. And also, as I showed um, an image of a projector, normally I was just, as this paper was being made, I just Googled it, how harmful could it be? I just typed on Flipkart or Amazon, I don't remember. There is a class 3B projector that is on sale freely. Even a kid can buy that for 5,000 something rupees. And class 3B, according to the classification, you shouldn't see it in directly. And even sometimes the laser reflections are harmful in these cases. Hence, the
I think 2022 or something, we are getting some reports from Mumbai also that Ganesh Visarjan period,
Yes,
and some reports from Dubai.
Yeah.
Okay, so this is increasing, and before that we had a discussion so that all India-wise campaign should be done banning the laser. But how far it has got, I have no idea.
Yes, ma'am.
So have you calculated the incidence prevalence of this? Have you done anything?
Actually, sir,
Haven't done that.
no, sir. It was just a
And
13.
second thing, you were saying that the power outputs from this thing and all. So of the patients who came in, did anybody look at what class they were? Like you looked up?
No, actually, the events were already over.
over. So you did
And
no idea. About
yes,
that, right?
but these mostly would have been class 3B because every patient was like, I looked at the laser light, it came, it was very instantaneous for them.
And what was the longest follow-up?
It was 3 months for this paper.
The
We-
longest follow-up.
Yeah, actually, we have these patients who follow up regularly because at Hubli, we're the largest center and they trust us. So it was in 2023. So we still have these patients following up. And as the OCTs were normal, you see, every patient had a normal OCT at follow-up. And 1, 2 had EZN, what do I say, photoreceptor loss. So then we didn't feel the need because the treatment was done.
Thank you.
So I'll invite the